Okay, insulin. All the insulin, or pretty much all of it nowadays, comes in concentrations, what we call U100, so 100 units per 1 ml. Of course, we have different dosages of insulin and all types of different insulin that you'll go through, and you'll go through the types in lecture. When you're giving an injection, you need to consider the number of units that you're giving. If it's a lower dose, if it's an odd number, you might want to use a lower dose syringe. This syringe holds 100 units, 1 ml. This syringe, for example, here it holds only 30, this one 50. It's much easier to read, say if I wanted 7 units, it's much easier to read 7 on here as opposed to trying to get 7 on here, and then it would make you be in between lines, and it would be, of course, then less accurate. So be aware, 2 different types of syringes usually. I don't know that every hospital will supply a 30, a 50, and a 100. At the hospital where I worked, we had a 50 and a 100. So anyway. Regular insulin is your short-acting insulin. Regular insulin is always clear. This, for example, is an NPH insulin. It is an intermediate type, and your intermediates are always cloudy. The cloudiness is a sediment. So if you look, I don't know how well you can see, but this looks clear. But if you turn it up on the bottom, you can see the cloudiness. And again, it's sediment, and it has to be mixed. So in preparation, the first thing I want to do is mix my NPH insulin. You don't want to shake it vigorously. You don't want to cause it to bubble up. You just want to roll it between your hands and make sure that it's well mixed. And then it becomes cloudy. All right, so let's say I want, hang on here. So I've done that. I need to cleanse the top of both, and I cleanse them well and let that air dry while I've read my order, and it's, let's say for example, it tells me to do 20 of each. So I have 20 of NPH and 20 of regular. So I'm going to pull back my plunger to 40 because that's my total dose. And then I'm going to put my air in both. And what I want to do then is, you know that you always need to draw up your regular insulin first. So I'm going to put my air, I'm going to put 10 of air into the cloudy, into the NPH. Excuse me, I'm putting 20. It was 20 and 20. Okay. And then I'm going to put 20 into the regular or the clear. And then once I've done that, then I can draw up my medication. One thing I didn't mention is there's not a hub on any insulin syringe, and the needles are not interchangeable. So, and you have to be cautious in holding on to this, or you're going to bend your needle back and forth. So again, my thing is always hold it by the neck, and you're a whole lot more stable. Okay, so what I'm going to do is pull back to the 20 units. You will get a small air bubble in there, and that air bubble actually comes from the air that was in the needle. You want to get that back up to the top, and then once it's up there, inject it back up into your vial, and then pull back again so that you don't have any air. I got it back, so I'm going to inject again. All right. So, and I'm going to make sure that I have no air in my syringe, and I'm going to stop exactly on the 20. Okay, so I have no air. Now I've already put air in this. I need to be very cautious that I don't inject any of my medication into here. So I will not get air this second time. Gosh, it's hard to get here. Hold on. Okay, I will not get air, so all I need to do then is pull from my 20 down to my 40 and stop. And I have my dose. Okay, you won't get air the second time because you had already gotten rid of it at the first vial. So you should be good to go. And then I would be ready to take this to my patient room. Help me, all right. And inject. Always remember, don't make the clear cloudy. If I get any of the cloudy into the clear, it's going to cause my whole vial to be intermediate acting. So that's why I'm always going to draw up from my clear first, from my short acting, my regular acting. I'm going to draw up from first. So, and I prepared both of my vials with air, and put your air in your cloudy, in your NPH first, and then secondly, put your air into the regular, so that once you've got your air in, you can just turn it up and then go ahead and draw. Okay. Okay, intradermal. I've prepared my syringe as before using the same technique and drawing up my medication. I'm going to use a sub-Q syringe. I can use the same type needle, or I can use a shorter, smaller gauge. My usual dose usually is around 1/10. And again, this is a 1 milliliter syringe. It's marked off in tenths. My goal is to go just under the skin, and again, I have cleansed my skin in the inner to outer motion. I want to go at a 5 to 15 degree angle with my bevel up, and I'm going to let's see, I'm going to pull the skin taut and inject. And if you go in about 1/8 of an inch, and then bring your hand back and inject. Well, anyway, these little things aren't so cool, but you should get a little wheel. Let me get some air here. You should get a little wheel. That's your goal. If you don't, if you go too deep, then you're not going to get the wheel, and then pull back out. I really have a difficult time on these. I think it's good to practice on someone's arm. That way it gives you an idea how you're going to hold it. I like to, sometimes you can pull from underneath, you can kind of pull from side to side, but it is a good idea that, you know, once you have pulled on the skin, what you want to do then is, again, I'm at the 10 to 15 degree. I want to be able to inject steadily, so that I'm not going to move my syringe. If I just barely have my bevel underneath the skin, very much movement at all, I'm going to come back out, and then I have to change my needle and re-stick. And so that's not the best thing to do. So however you choose to do it, and actually it's better, say if this were someone's arm and I'm going to inject and then let go and then come back here and inject the medication. I'm not going to move this hand, because if I move that hand around, then, you know, certainly, you know, a lot of people say, well, I want to do this and then I want to stabilize it with this hand. You know, you're asking for trouble if you switch hands. If you try to keep this hand in the same spot, once I go in, and then I can let go and then come back here and inject. Try to keep movement to a minimum on this syringe, again, because you'll come right out from under the skin. 5 to 15 degree angle, but kind of put the cap on and practice on a real arm as opposed to this. I mean, this gives you an idea, and if you get it just right, they've been stuck a lot, and so a lot of the little bubbles won't hold. But I don't have any air in it. Well, anyway, when you inject, you want to inject to just beyond the end of the bevel. Again, you're getting about 3 millimeters or 1/8 of an inch under the skin. Hold it steady and then come back and inject.